Let me now go, and I'm really happy to welcome Dr. John Barnard, who is the Chief of Pediatrics at Nationwide Children's Hospital and President of the Research Institute at Nationwide Children's. Doctor, welcome. Thank you very, very much for being with us. And I know that I've been told that you've been leading a team of physicians and researchers across some of Ohio's children's hospitals to analyze the prevalence of COVID-19 among children. And I wonder if you could just maybe tell us some of the things that you have found and kind of what the status is of COVID-19 among our young people in Ohio today.
Thank you, Governor DeWine. I am privileged to speak on behalf of Ohio's 6 children's hospitals, which are overseen by and work together under the auspices of the Ohio Children's Hospital Association for really many, many years, but certainly in the COVID era, we've been working much more closely together to share best practices and ideas and also to collate data. So for the past few months, we've shared our data with one another, and I'll review some of those learnings with you today.
Great.
So first off, a few high-level comments. If children get coronavirus infection, let's be really crystal clear. They get coronavirus infection, and they get it not infrequently. Fortunately, most children are reasonably well with their symptoms of COVID-19. We know that about 90% of them do really exceedingly well. However, a smaller fraction, 10% or maybe a little bit less, actually get sick and need to be in the hospital. And children with certain medical conditions actually can become critically ill and have been hospitalized in our Ohio Children's Hospitals and in our intensive care units. So small number get really sick. Most kids do well. We're very grateful for that. But just to make sure folks know, it can be a very serious disease in certain children. Now, in Ohio Children's Hospitals, we're privileged to have 6 of the country's best here in Ohio. We took a different cut at the data, and we were really interested in knowing what fraction of children, what percentage of children who have symptoms that are compatible with COVID actually test positive. So we've done, over the course of the past 5-ish months, we've done about 14,000 tests for COVID in children that have symptoms that suggest to our physicians that it may be compatible with COVID, and we found 8.6% positivity. We're also interested in the test positivity in children that don't have signs or symptoms of COVID. And we're not out surveying in the community, so how can we get a best estimate of that? Well, most of us are testing all the children admitted to our hospitals, whether they have COVID-like symptoms or not. And we're also testing children that are going to undergo surgery in the near future. That's an outpatient elective surgery. So that's as close as we can come to a asymptomatic population, which has been talked about very frequently in the lay press and also in the medical journals. And since mid-March, when we first started testing, we've done about 20,000 tests in these asymptomatic children, and we find a positive rate from the beginning of about 1.4%. Now, I would like to point out that that number has been rising in the past month or so, and is now at about 2.9% if you just look back for the prior week. So we do think that there's some increase in the number of children that are asymptomatic but test positive for COVID. And by the way, I do want to say that the information that I'm giving you today is in children that are basically less than 18 years of age. We have also broken down our data by age. We're very interested in the spread from age 0 to age 18. And we have found that older teenagers or really young adults at the age of 17 are the highest prevalence of test positivity amongst all the children that we test. And we believe that's because 17-year-olds are now often driving, and they are socially much more active and tend to test positive statistically significantly more than younger children. Now, let me talk a little bit more about the severity of the disease. So of all the children that we've encountered that have been positive across the state, 8% have required admission to one of our children's hospital. And of those 8%, 1% have had to go into our intensive care unit, and some have been really critically ill and on ventilators. So again, it can be a very serious disease in children. And some of these cases occur in children with underlying medical conditions such as obesity and type 2 diabetes, type 1 diabetes, for example. And the last thing I would like to say just about the types of children that are getting COVID in our state is that we have learned that the prevalence of test positivity is 4 to 6 times higher in children from underrepresented minority groups, specifically Hispanic children and Black children. That's an observation that's really played out across the United States, and it certainly seems to be playing out here in Ohio, regardless of the cities in which our children's hospitals are located. So finally, I think many of us have heard about this multi-system inflammatory syndrome of children. And interestingly, here in Ohio, we've had 13 cases that we've identified at our children's hospital, and far, far fewer than some of the hot spots across the country like New York, Miami, and others. So I think we're fortunate in that regard. In fact, some of our hospitals have not even seen a case. And I just will report today, happily, that as of this morning at about 7 o'clock, none of our children's hospitals had children in their intensive care units being cared for with COVID. So a good report for today, at least.
Well, Doctor, thank you. That's very thorough, and